Welcome, everyone. It's the top of the hour, and we're just going to give it a minute to make sure that everybody is logged on. Thank you for joining us. All right, let's get started. Welcome to our town hall. I'm Clara Hughes, a six-time Olympic medalist in speed skating and cycling, and I'll be your moderator tonight for the town hall. She, hers, and I am proud to say that I'm on Treaty 7 territory, the ancestral homelands of Blackfoot, Tsuut'ina, and Stoney Nakoda people. I am not a doctor, but I'm honored to be here with 7 incredible panelists who are. Why are we here? Because Canada is facing one of its most difficult challenges. We have all been affected and impacted by COVID-19. With so many sources of information, we have questions, concerns. People want clarity and certainty when it comes to vaccination. Who better to answer your questions than a group of Canadian physicians who are at the forefront of the fight against COVID? This is our shot, Canada. Doctors, thank you for your time this evening and for your service. Let's meet our panel. Doctors, you can go ahead and introduce yourself, please.
I'll go first. I think we'll go alphabetically, maybe. I'm Isaac Bogosh. I'm an infectious disease physician. I'm based out of the Toronto General Hospital. Thanks for having me here. Look forward to chatting.
Hi, I'm next alphabetically. I'm Jia Hu, a public health physician based in Calgary and chair of 19 to 0. It's a national coalition aimed at ending COVID quickly, and very happy to be here this evening.
Hi, I'm Madhu Jawanda. I'm a family doctor, part of the South Asian COVID Task Force, and I work in Surrey, British Columbia.
I'm Alika Lafontaine. I'm a member of the Indigenous Urban-Related Homelands COVID-19 Vaccination Task Group. I live and work and play in Treaty 8 up here in Grand Prairie, Alberta.
And my name is Anaí Perlas. I'm an anesthesiologist based in Toronto and also a member of the Latin American COVID-19 Task Force in the GTA.
Hi, I'm Modupetunde Bias. I'm an obstetrician and gynecologist working at North York General Hospital. I'm also the president of the Black Physicians of Canada. Thank you for having me.
Hi, my name is Anna Wallach. I'm a family physician from Vancouver, Canada.
Thank you, doctors. And we're getting so many questions. There are so many people tuned in, and I don't know if we're going to get through every question. So please, if your question is not answered tonight, contact your healthcare professionals and get those questions answered. Every question is so important. Before we go into our questions, however, we have a special message from Tyler White, CEO of Siksika Health.
Okay, my name is Tyler White, and I'm the CEO for Siksika Health Services. We provide health and wellness care for Siksika Nation and surrounding communities here in the Blackfoot Confederacy. Right now is the perfect opportunity to slow the spread of the virus and ensure our most vulnerable and at-risk populations throughout Canada are protected from COVID-19. Indigenous families face barriers to accessing quality health care, and many Indigenous communities like mine continue to ensure that COVID-19 vaccines are quickly made available to our nation members. The vaccine is a hopeful next step in reducing COVID-19 spread, but we cannot let our guard down. It is important for us all to continue efforts to stop the spread of COVID-19 by washing our hands, wearing a face covering, and practicing physical distancing. Getting the COVID-19 vaccine as soon as it is available to you is our shot at putting this pandemic behind us and enjoying ceremonies and celebrations. This is our shot. Let's do what we can to protect our elders, families, and communities.
Thank you so much, Tyler, for your wisdom and experience shared. Let's get into the questions. Dr. Jawanda, what is the best vaccine to get and why can't I get it later? Why can't I wait?
That's a great question. I'm sure everyone's heard of this before, but the first vaccine that you're offered is the best one, the one that goes into your arm. All vaccines are equally protective against serious illness, sickness, hospital, ICU admissions, and death from COVID-19. So don't wait. Please get vaccinated as soon as you are able with whatever vaccine is offered. And the reason we don't want people to wait is we want to do our part to combat this virus, to stop the spread. When the virus is spreading around in the community, it is allowed to mutate and spread further and cause more havoc. So the sooner that we get vaccinated, the sooner life gets back to normal. So the three things as Canadians we can do: social distance, mask, and please get vaccinated.
Excellent, thank you. Puis en français, est-ce que je devrais me faire vacciner par AstraZeneca ou attendre le vaccin de Pfizer ou celui de Moderna? Dr. Jawanda.
La vérité reste qu'en ce moment au Canada, votre chance d'être admis à l'hôpital ou avoir la COVID est très haute. Quand on compare le vaccin mRNA au vaccin J&J et AstraZeneca, on oublie de parler d'un comparateur important: la mortalité et les infections sérieuses. Tous les vaccins diminuent la mortalité et les infections sérieuses à presque 100%. Puis, tous les vaccins diminuent la transmission virale.
Excellent. Dr. Bogach, why did Canada delay the second shot, and will this tactic work?
Yeah, so the second shot in Canada is delayed so we can get a first dose fast approach. So basically, we can get a single dose in as many people as possible in the shortest time possible. We know there's actually pretty significant protection even after one dose. Of course, 2 doses is better. We're all going to get our second dose. But when you have a shortage of vaccines, if you use this first dose fast approach, very similar to what they did in the UK, we can really provide much better protection. And you know what? Quite frankly, we're going to get a ton of vaccines pouring into the country. It's unlikely that we'll have to wait 4 months for our second dose. Most of us will probably get it before that 4 months. But let's see. I think we need to really ensure that we know exactly how much vaccine is coming to the country before we can start to schedule those second doses. There'll be a maximum of 4 months, but many will get it before those 4 months.
Okay, but what if these doses don't come? What if they don't come in time? What if there's delays? Will there be any mixing and matching of those second doses compared to the first dose a person gets? And will that work?
Great question. So you know what? We have to be careful, of course, and certainly ensure that everyone does get access to the second dose. We are having tons of vaccines roll into the country, so it's pretty clear we will get those second doses. Mixing and matching is really interesting. There's a trial going on in the United Kingdom right now looking at first dose of X, second dose of Y. We'll have the results of that probably in the next few weeks or so, not more than a month or two. And we don't have the results, so it's hard to say, but I don't think anyone would be surprised if mixing and matching vaccines, appears to be a reasonable thing to do and provides robust immunity and safety as well. But again, no one's doing that just yet. We'll wait for the results of the clinical trial. And based on those results, we can adjust our policy if need be.
Okay, we'll be waiting for that updated information for sure. Dr. Hu, how long will the vaccine last and will I need a booster?
Yeah, that's also a great question. I mean, we don't know for sure how long the vaccine will last yet. They've only sort of been around for 4 or 5 months. If we look at sort of natural immunity, though, it does begin to wane in many people 6, 12 months out. And I think more and more we think it's pretty darn likely we'll need a booster. But I mean, I would say this: booster, maybe yes, no. At the end of the day, I think if what it takes to getting a booster a year to never live 2020 again, I think it's definitely a booster worth taking. And, it's really critically important right now that people just get that first dose in. We can sort out that booster thing in due time.
Okay. All right, everyone. If you haven't seen Gurdeep Pander's celebratory Bhangra on those frozen lakes up in Yukon, you have to Google him on YouTube. Check him out. It will lift your spirits no matter what's happening in your day. We're fortunate to have a question from Gurdeep actually, it's for you, Doctor Who. Here's Gurdeep.
Hello everyone, this is Gurdeep Pandey speaking from the Yukon. My question is, do the vaccines protect from the variants which have been identified? Thank you. Thank you for organizing this town hall.
Oh, I love the video question. I feel like I'm on Jeopardy. I think that's a really also an excellent question. I mean, we know that the vaccines, all of them work pretty darn well against the UK variant, which is sort of like the variant that accounts for like 99% of all our variants. And so all, Pfizer, Moderna, AstraZeneca, they basically work the same against that as the regular COVID. For some of the other variants like South Africa, India, Brazil, less sure, but fortunately for us in Canada right now, it's like 99% UK. So, if we're worried about variants, again, the best thing you can do is just get that vaccine as soon as you're eligible.
Okay, thank you. Dr. LaFontaine, why are people still getting COVID if they've had the vaccine? And does this mean the vaccines don't actually work?
This is a really great question. As an anesthesiologist in the operating room, us in the OR team have asked this question, so you're not alone. It takes a while for the body to build immunity once you get vaccinated. And so if you get exposed to COVID right before or soon thereafter, before you have the opportunity to build immunity, there is still the chance to catch COVID and get sick. Other possibilities are that you're part of that very small proportion that is vaccinated but can still catch COVID. The great thing about it, especially being vaccinated, is that if you do get vaccinated and you have immunity and you do catch COVID, you often get much less sick. So this is really our shot at making sure that we get back to life as normal. So get vaccinated early, and chances are you'll end up having a less worse course if you do end up getting it again.
Okay, thank you. Dr. Jawanda, I've heard of AstraZeneca causing blood clots. This has been front and center in the news. Is this true, and what is the risk?
Another great question, and definitely forefront in the news. We always have to put risks into perspective with the benefits and be transparent about it. So with AstraZeneca, there is a very, very small risk of a very rare blood clot. We can't say it's 0%, but it is indeed very small. In Canada, we've given out hundreds of thousands of doses, globally millions of doses, and it really has proven to be beneficial. Always when we're giving vaccines or any type of treatment, we're balancing benefits and risks. Compared to the AstraZeneca vaccine, if a person does get COVID-19, the infection, their chances of a blood clot are about 30,000 times higher. So we are in a third wave. There's a lot of COVID in our communities, and AstraZeneca is a safe and effective tool to combat the COVID-19 infection.
Okay, thank you. I actually got the AstraZeneca shot yesterday morning and just so relieved, so stoked. It was a gift. All right, let's move on. Dr. Perlis, I have a lot of allergies. Should I get the vaccine?
That's a good question. So there's only a couple of allergies of concern. One of them is if you have received your first dose of a vaccine and you develop a serious allergy, then it's recommended that your second dose is from a different kind of vaccine. The other allergy of concern is if you're allergic to any of the components of the vaccines. So more specifically, polyethylene glycol, which is a component of the Moderna and Pfizer vaccine, or polysorbate, which is a component of the AstraZeneca vaccine. These allergies are exceedingly rare. Just to give you an example, polyethylene glycol is a very, very common substance in everyday products, such as shampoos and toothpaste. So it's very, very rare to be allergic to that. Other than that, all the other regular allergies that people may have are not a concern whatsoever in terms of the vaccines. So allergies to other medications, allergies to pollen or environmental, allergies to bee stings, allergies to foods, they are not a concern at all regarding the vaccines. And For these kind of allergies, people don't need to have a specific consultation with their allergist before getting a vaccine shot.
Okay, thank you. Thank you so much. Dr. Wallach, when should you get a vaccine if you have had COVID?
Thank you for that question. Absolutely. Even if you have had COVID, you should still get vaccinated. We don't know how long the antibodies from your acute infection are going to protect you. And we know that the immunity you get from vaccination is longer lasting. So please, even if you have had a COVID infection, you do need to get your vaccination. As for timing, up until recently, we were told that you had to wait 3 months from recovering from the infection before you could get the vaccine. But now the guidelines are saying as soon as public health has cleared you and you are out of isolation, you can get the vaccine that you are eligible for. So please get the vaccine as soon as possible.
Excellent. Dr. LaFontaine, I'm worried that these vaccines were developed too quickly. People are like, how can this be? It seems too good to be true, right? So are they actually safe?
So this is a pretty common question. I think a lot of us get asked. It's old technology, but maybe a new application. A lot of these techniques have been around for years, decades or more. We should keep in mind that Health Canada has very robust approval processes. So all of these shots that are available, no matter which vaccine you get offered, they've all gone through this approval process. And finally, just keep in mind, never in the history of the world have we really been confronted about something like this, at least in my lifetime. And so you have the entire world looking at this, researchers, countries, all these resources pouring in to solve this one problem. And so this really shows us how we can solve problems if we all come together and focus on the same thing. But the vaccines are absolutely safe. They've gone through robust approval processes. And the reason why they came quickly is because of how urgent it is to actually treat this.
Thank you. Thank you. Dr. Perlis, why do I need to keep wearing my mask and distancing if these vaccines are so great?
Yeah, thank you for the question. I think people find this one confusing, but there's very good reasons that we continue to use our masks and continue social distancing after vaccination. In the first place, it takes about 2 to 3 weeks to develop immunity after you have your shot. So during those 2 to 3 weeks after your vaccine, you may still be vulnerable to contracting COVID-19. After those 2 to 3 weeks, the coverage from your first dose is substantial, but not complete. And even after you received your second dose, when the coverage is so high and so good, you will be protected, but we are not 100% sure that you can still transmit COVID-19 to other people, even if you are not the one getting sick. So for that reason, we're recommending that even after you get vaccinated, you continue to wear your masks when you're in public, and you continue to maintain social distancing to protect you and protect others. Until such time when the vast majority of Canadians get vaccinated. And then at that time, then the situation will change and we'll be able to stop doing these things and stop wearing masks. But we still have a little way to go for that.
We have another video question coming in from a champion athlete, a world champion hurdler, best-selling author of My Mother's Daughter, broadcaster for the possible upcoming Olympics in Tokyo, Perdita Felician. And this question is for Dr. Tunde Bayas.
Hello, Perdita Felician here. I am the best-selling author of the memoir, My Mother's Daughter. I'm also a world champion hurdler and a broadcaster. So my question for the doctors is, when it comes to the vaccine and women who are pregnant or maybe plan to become pregnant, what's the deal? Is the vaccine safe for them? Should they not take it? What's the best advice? Thanks.
Thank you so much, Felician. And this is a very common question. And as an obstetrician addressing the same questions today, I can tell you that most pregnant women will have mild to moderate disease, but there's a small proportion, about 10%, that will develop severe illness. which means they require ICU admission, they are under ventilation. And we've seen that in the last 3 weeks in our hospital. The risk at that time increases by cesarean section, stillborn, and even preeclampsia. So the advantage, on the other hand, of receiving the vaccine is that the risk of death is almost 100% prevented, and also reduces the risk of long-term complications. So our recommendation also is that the vaccine also provides immunity for the unborn baby. So recommendation is for all women to be vaccinated anytime during the pregnancy and get any kind of shot, because this is our shot. And also we need to understand that the doses, before you get pregnant, you may want to take the 2 doses. If not, if you're pregnant while you're taking it, continue to get the vaccine. It is very safe, and this is our shot. This is the only way we can get the pandemic behind us. Thank you.
Dr. Tunde Bayas, we have another question for you, and this has been floating around the media a lot this week, and it's kind of a loaded question. It's, will this affect my fertility for both men and women? And for women specifically, will it affect my menstrual cycle?
Very good question as well. And I was just on call yesterday, and people were looking at the social media, and this is a buzz. All I would say is that there is no scientific evidence up until this moment that COVID-19 vaccine affects your fertility, whether you're a male or you're a female, and it does not affect your menstrual cycle. So it's safe to get it. This is our shot. This is the time to roll up our sleeves and get the vaccine.
Okay, thank you. And what about the menstrual cycle for women specifically?
Still no evidence that this is affected. And we now have the data in pregnant women showing that this vaccine is safe, and we don't have any scientific data about menstrual cycle, but there's really no reason for this vaccine to affect your menstrual cycle.
Excellent, thank you. Dr. Wallach, why aren't kids getting vaccinated?
That's an excellent question. And as the mom of young kids myself, I'm like, I can't wait to get my kids vaccinated. When the vaccines were first approved for use by Health Canada, the data came from clinical studies that had only included adults. Remember, this is we've tried to release this as quickly as possible based on the best science available. So currently, both Pfizer and Moderna are conducting trials in children as young as 6 months old. So even the littlest, teeniest, tiniest babies, we're going to get them vaccinated. As the results of the studies and the trials come out, age eligibility will be adjusted. So I am as eager as you are to get the approval to get our kids vaccinated, because this is our way out of here. We cannot achieve herd immunity without our children, so we cannot wait for this to happen.
All right, before we go into some more questions, we have a special video message from Nancy Itak, who's an educator, community member up in Kanyakswalujwak in Nunavik, in the Inuit homeland of Inuit Nunangat, up in northern Quebec, and she has a message for all of us today.
Hey, Nancy Tonga, Kanyakswalujwak miok Nunavin me, ilinetit si angayokhangan of Tungaligi Yoyunga. Hello, my name is Nancy Tuk. I'm from Kanyakswalujwak, Nunavik. I am the Vice Principal at Ulurek School. Being from a small town, we do not have much medical resources, but we're really lucky. We have an amazing doctor, Dr. Steve Arnold, who is very passionate about education and educating people. So Dr. Steve and I, we went on our local FM radio station and did a presentation about COVID-19, where we had people call in with their questions and concerns regarding the vaccination. And so that was a great success. Most of us have been vaccinated, but we know the pandemic isn't over. So we will continue to work together and keep our community safe by educating everyone regarding COVID-19. Nakamik.
Nakamik Nancy is a wonderful, wonderful person that has led her community as well as other community members through this incredibly difficult time. We're so grateful for your wisdom. All right, here's another question. And this one is for Dr. Wallach and Dr. Tunde Bayas. So if I can get both of you to touch on this one. And I think this is a question every single person has who's excited about this. How do I talk to friends and family who are hesitant to get the vaccine?
So the first thing is to ask them, why are they hesitant? Because if you don't address that, then it's going to be difficult. So listening to that, then it's easier to find people where they are not comfortable with. If it has to do with education, then we would talk about that. If it has to do with side effects, we would say that this is very safe. If it has to do with people not being comfortable or looking for other people that very much look like them, then you can look at community vaccinators to talk to them. So there's a lot of things that we can do to educate people to increase their vaccine trust.
Exactly. This is a great question, and a question that a lot of family doctors are wrestling with every single day. How do we talk to people who are hesitant? And that question is exactly why we are holding this town hall. The best thing to do, like Dr. Tunde Bayas said, is listen to people. Find out exactly what it is they're concerned about. Explain why you're taking the vaccine. Maybe you want to protect yourself or protect a loved one with a serious disease, or protect yourself as a frontline worker. Take the knowledge that you're going to get from the town hall. We have excellent physicians on board, and we're going to answer as many questions as we can and address the concerns that your friends or family have. The other thing is, if you're viewing this on the This Is Our Shot website, the website you're on has FAQs in different languages. Print them out, give them to your friends and family. The most important thing is that they trust you. You are a safe space for them. Support them and reassure them. Don't just disregard them. Listen to them. Remember, getting vaccinated is the single most important thing that every one of us can do to protect ourselves, our loved ones, frontline healthcare workers, and the most vulnerable in our society. This is what will get us out of our pandemic. This is our shot at getting back to pre-pandemic life. This really is our shot.
Excellent. Words to live by. Thank you, both of you. Dr. Bogach, will I need the vaccine to travel? There's been a lot of talk about vaccine passports. What do you think is going to happen with this?
Okay, this is a good one. So vaccine passports mean different things to different people. Let's focus on international travel. So crossing international borders and showing proof of vaccination to COVID-19 to cross international borders. So that's just the terminology we'll use for this question. Short answer is many people are going to have a lot of opinions on this. Some people think they're good. Some people think they're bad. Some, we're not here to discuss what we think about them. This is happening. Whether you like it or not, this is happening in many parts of the world. So you may as well be prepared for it. We're starting to see early signs of this. For example, the European Union announced that Americans who are fully vaccinated can travel there in the summer. We're seeing other countries around the world say that they want to have evidence of vaccinated individuals before they allow them into their country. So again, we can debate the merits, the ethical issues, all we want, but it's not only happening, it's actually here. So, I don't know what else to say. It's just important that we know this, because if you want to travel internationally and you're not vaccinated, you'll probably have some limitations.
Okay, thank you. Dr.
Can I add one other point, Claire?
Oh, yeah, go for it.
Just one other interesting thing. This is also not a new concept, right? There are over 60 countries on the planet where you have to show evidence of vaccination for another infection, an infection called yellow fever, which is a mosquito-transmitted infection, devastating, causes big outbreaks, kills lots of people. So you can't go to a bunch of countries, over 60 countries in the world, without showing evidence of yellow fever vaccination. If you show up and you don't have your yellow fever vaccine card, one of two things is going to happen. Number one, they're going to turn you around and put you on the next plane out of there at your expense. And number two, you can choose to come into the country, but they're going to inoculate you right then and there in the airport. So like, this is not a new concept. This has been around for a long, long time. And I think we'll expect to see a lot of this with COVID-19.
That's such a good point, comparing it. I have my vaccine, that yellow slip from travels. So yeah, and all the other vaccines as well. Dr. Joanna, we're going back to the AstraZeneca here and the blood clots. What symptoms should a person look out for if they're worried about that blood clot, if they've had that vaccine?
Sure, thanks, Sarah. Another great question. So first of all, I just want to say that after one has had a vaccine, immediately after, within 1 to 2 days, you can have a bit of a sore arm, body aches, feel a bit feverish, have a bit of a headache. I know I have that with my doses of my vaccine, so completely normal. Now with AstraZeneca, the things that we want to watch out for will occur between days 4 to 20 after your first dose. And those are very extreme side effects. So they would be a very severe prolonged headache that's not going away, a seizure, difficulty walking, difficulty talking, severe abdominal pain, swelling in extremities, very unusual bruising. If you have any of those, then, and also, shortness of breath, chest pain, if you have any of those, then please seek immediate attention.
Okay, thank you. And Dr. Hu, this is for you. If I have had the Pfizer vaccine and it turns out that boosters are required yearly, will I always get a Pfizer vaccine? Have they studied what might happen if you get more than one type of COVID vaccines? We've kind of answered this, but this one's a little more specific about way in the future that we hope we get to.
I think we can get to that future if we got immunized, but I'll say the exact same thing that Dr. Bogach did. There are trials looking at mixing different vaccines. But for now, we're sticking, if you had like an mRNA vaccine, you'll get an mRNA vaccine. But that could change in a few months, but we'll do it in a sort of science-based way.
Okay, thanks. And this probably should go to the end, but I'm going to ask it right now. I'm going to drop it on you, Dr. LaFontaine. Is this ever going to end?
So everyone here on the panel, I'm sure most of the viewers, we're all tired of seeing this every single day. And I think because of the 24-hour news cycle, it's always there. No matter where you go and look, COVID's in the news and, reminding you about all the changes that we've all had to go through. I can tell you, just like I can tell you that with your anesthetic, you'll eventually fall asleep, I can guarantee that we'll make it through this. This will eventually come to an end. And, the reason why we all came together and are spending time here tonight with you is because we know that getting vaccinated is one of the ways to speed up coming to that end. I was on call earlier tonight. I have to get wrapped in plastic with a gown, gloves, an N95 mask, a hat, a face shield. Every single patient, I take those on and off to make sure that you stay safe. Getting your vaccines the way to help me get through this. It's the way that I'm going to help you get through this, and it's the way that we're going to help each other. So take your shot, help us get through this faster, but we will get through this.
Okay. Thank you. Words to live by again. Thank you. That's hopeful, but it's also a good dose of reality. Thank you for sharing that. Thank you so much. Dr. Hu, I understand that we may have a vaccine for kids 12 and over shortly. My kids are under 12, 10-year-old twins. One of the twins has asthma, so we've been super careful during this time. We have been anxiously awaiting word on when the kids might get vaccinated. Has there been any work done about vaccines for kids under 12?
Under 12. There's a lot of trials happening right now with kids under 12, 6 months and up. I think it's good news that the reports from the trial 12 and up showed the vaccine was effective and safe. And, I don't doubt that the same will apply for kids under 12. And, hopefully, those trials will report the results just in advance of summer. We'll see for sure. Just in time for, the Gen Kid immunization program to start. But, I think they probably will be very safe and very effective.
Okay. Dr. Perlis, you know, these side effects that can happen after the vaccine, you know, the headache, the whatever they are, however they manifest in you, the list of side effects, how do we know it's not COVID?
Yeah, thank you. That's a good question. Well, important thing that differentiates them is that the symptoms that are common after the vaccine are typically very self-limited. So they start right within 24 hours of the vaccine, and they last anywhere from 24 to 48 hours. So they're very self-limited. The kinds of symptoms we're talking about are pain and swelling at the site of the vaccine. You can have a fever. You can feel fatigue, just overall low energy. And some people can have a headache and a bit of a sore throat. Those are by far the most common symptoms. They are common. A lot of people get them. And as I said, the main difference is that they are short-lived, and within 24, 48 hours, they go away. Now, if you start getting something different, like a cough, for example, and shortness of breath, those two symptoms are not typical common side effects of the vaccine at all. And if you get a bad cough that is not going away, or if you get shortness of breath, then you need to seek medical attention, because one of the possibilities is, of course, COVID. And as we discussed before, in the first 2 to 3 weeks after the vaccine, your body has still not had the time to build the immunity. So if you happen to have contact with a COVID positive person in the last few days before you got vaccinated, you may be developing an infection afterwards. And that's the way to differentiate them.
Okay, thank you. And I can attest to the headache, that mild side effect. I have it right here, but it's okay. It's not bad. This is for Dr. Bogach. With the COVID vaccine, the first to use mRNA, can we expect any adverse long-term side effects 12, 18, or 24 months after dosing? Is there any data available specific to the COVID vaccine to support your answer?
That's a great question. So listen, let's just talk about vaccines in general. Like, obviously we have to be very transparent and honest about what adverse events there are. You just got to tell people exactly what they can expect. When people talk about long-term adverse effects of a vaccine, you know, again, in total transparency, those exist. Like luckily it's extremely rare, but some people have received a vaccine. I'm not talking about any particular ones, but there have been vaccines received. And then sadly, and of course, rarely, some people have had long-term side effects. The interesting thing is those long-term side effects, when we say long-term, means they can occur over a long period of time. It doesn't mean that they're going to randomly appear 2 or 3 or 4 years later. That's not how this works. They usually appear, if they're going to appear, right around 1 to 2 months after a vaccine. I can't think of any vaccine ever that had a negative effect that started years after the vaccine was administered. So we don't expect to see anything like that happen. Now, of course, doesn't mean there aren't going to be adverse effects from the vaccines. Like any drug, any vaccine, any product you have has the potential for an adverse effect. We know, for example, with AstraZeneca and with Johnson & Johnson, for example, those aren't mRNA vaccines, but they're vaccines. Yeah, there's a very rare, but not 0% chance of these blood clots. Okay, weren't seen in the clinical trial. Those clinical trials enrolled tens and tens of thousands of people, and they weren't even seen in the clinical trial. You had to roll them out and to millions of people before you actually started to see them. That's how rare they were. But again, just to go back to the point, always the potential for long-term side effects. It's rare, and if they're going to happen, they happen usually within the first 2 months.
Okay, thank you. Dr. Jawanda, I'm terrified to have the AstraZeneca in pharmacy. Supposed to get it tomorrow, but don't want to get it. A Quebec woman died, 54 years old, and I'm 57 with some underlying health issues, not able to reach my family doctor. You're muted.
That is an excellent question. And honestly, the first thing I want to do is send my condolences to the woman's family and friends, because that is honestly a very tragic event. And whenever as a country we reel in shock when we hear this. It's not something we want to talk about. It's not pleasant. But again, it goes back to the whole idea of the safety, the risks versus the benefits. And the chances right now with so much COVID in our Canadian community, we really should get the AstraZeneca vaccine. So I understand your concern. I understand the fear. I had one of my friends just text me this morning who is also in her 50s with the same question. And I texted her throughout this, and she got her vaccine and sent me a picture. And you will be fine. It is the right thing to do, but I do understand your concerns. And even with underlying health conditions, there's really no absolute contraindication to get it. So I'm sure you'll be fine, but it would be great if you could contact your family physician, but you'll be fine.
Thank you. Dr. Tunde-Bias, is there any information on impacts on breastfeeding mothers and their babies from the vaccines?
That's a great question, and people always ask about that. So what we have now, and what we know from research, is that there are antibodies being made after the COVID vaccine has been received, and this seems to protect the baby. So the bottom line is that it's still very safe. You should still get it, and you should get it as soon as you can.
Okay. Dr. Perles, what is the ingredient that makes J&J one and done dose versus the 2-dose others? Is it truly safe? J&J, Johnson & Johnson, has been known to have class action lawsuits decades later. What makes this different?
Actually, I don't think I'm the best person to answer this question. If you don't mind, may I ask one of the other members of the panel to jump in?
All right, so who wants to take on the Johnson & Johnson question?
I'd volunteer, but I wasn't paying attention.
Okay, what's the ingredient that makes Johnson & Johnson one and done dose versus the 2-dose others? Is it truly safe? Johnson & Johnson has been known to have class action lawsuits decades later. What makes this one different?
Anyone else? I'm happy to chat, but obviously open the floor to anyone.
I mean, yeah, we can chat about it. I mean, why don't you go first and I'll fill in?
Just the way so in simple terms, the way the vaccine was made and the clinical trials demonstrated safety and efficacy for a single dose. It works. The whole plan was to design a vaccine for a single dose, and it works. It's called a viral vector vaccine. It's just the way it's made and the way it delivers the little, let's just call it, tiny component that resembles a part of the virus to your body so that you make an immune response to it. Really effective vaccine. The adverse effects from Johnson & Johnson, again, not 0%, but like really, really low. About 7 million doses administered in the United States, and they've had less than 10 of these events recorded. Same in Europe, they've had very, very few of these recorded. I think it's important to contextualize risk. Like obviously it's not a 0% risk, but the risk is exceedingly small. We also have to factor that into, for example, look where we are in Canada. We've never had this much COVID-19 ever in the country. We just haven't. We're neck deep in a third wave right now. There's a lot of COVID-19 out there in much of the country. Here you have a vaccine that's effective, like really effective, and also really safe, just has a very tiny risk of an adverse effect. I mean, I think it's important to frame it in just an honest manner.
Dr. Hu, do you have anything to add to that?
No, I mean, I think you nailed it. I mean, why does one dose work? The studies show it does, right? We're always looking at how these things respond or behave in the real world. Very similar to the AstraZeneca vaccine. And again, just what everything else said, like, you know, J&J should come to Canada pretty darn soon, and people are going to be eligible for it, and they should get it.
Okay, excellent. Dr. Wallach, this one's for you. Are vaccines safe in people with autoimmune disease? If I'm on an immunosuppression medication, should we try to time the vaccine in between our doses?
Thank you for that question. So I've seen a lot of these discussions for sure with my own patients, and I've spoken with a lot of rheumatologists who do deal with the autoimmune diseases. And by and large, everyone has told me that it is safe for somebody with an autoimmune disorder to get the vaccine. And in fact, in British Columbia, somebody with autoimmune disorders on immune suppressive medications are actually pushed higher in the vaccine line as a clinically vulnerable patient. So it is safe. The timing should be discussed with your own rheumatologist and your own specialist. And I suspect by now, if you are on one of these drugs, your rheumatologist or your family doctor has already reached out to you to discuss these concerns and about the timing. But yes, the answer is for somebody who does have an autoimmune disorder, it is completely safe, and you're at a higher risk, in fact, of getting COVID. So please get the vaccine.
Okay, excellent. So yes, get the vaccine. Yes, talk to your rheumatologist, talk to the professionals that know your file really well. This one's for Dr. LaFontaine. Can you get COVID from a vaccine?
So I'll pass it off to some of my other colleagues on the panel, but it's important to know that the vaccine stimulates your immune system to respond to COVID. It's not COVID that you're being given. And so can you catch COVID-19 from the vaccine itself? No, I personally, through my readings and understanding of the way that the vaccines work, no, you can't. Can you catch COVID from somewhere else? Pretty much, or soon before you get the vaccine or soon thereafter, that is a possibility. But I'll leave it to some of my other colleagues on the panel.
Thanks.
I can jump in maybe on that one, if that's okay. So you can't possibly get COVID-19 from any of the vaccines that have been approved in Canada, because none of the vaccines, the 4 vaccines that are approved in Canada, none of them contain the virus itself. And in order to get COVID-19, you need to get the virus itself. So the way the vaccines work is the 2 mRNA vaccines, the Moderna and the Pfizer, they actually simply have mRNA. So they have a code that teach the cell how to produce a protein that looks like the protein of the virus, but there's absolutely no virus in those vaccines. And the other 2, the AstraZeneca and the Johnson & Johnson vaccine, use a vector, use a completely unrelated virus that is completely harmless to humans, and is the virus that is often implicated in a common cold. And they use that virus as a vector, again, to have a sort of code that teaches the human cells to produce this protein, this substance that looks like the virus, but they don't contain the virus at all. They don't contain the dead virus, they don't contain the live virus, and they don't contain an attenuated virus at all. So you can't possibly get COVID-19 from the vaccine itself.
Thank you, Dr. Perlis. Dr. Tunde Bias, this is for you. When should pregnant clients receive COVID-19 vaccinations? This direction is very ambiguous and seems up to the client's direction. My OBGYN has not recommended which trimester is safe or to wait until after the delivery.
So that's a great question. And women always have choices. Okay. So looking at the recommendation from the Society of Obstetricians, women can get the shot at any trimester, 1st, 2nd, 3rd. That's one choice, and we are strongly recommending that. However, if a woman decides not to at that point because they want to wait for more research, they can do that after the baby is born or after they've stopped breastfeeding, and those may be the late adopters. Otherwise, the recommendation is to get this vaccine anytime during the pregnancy, and you should get any shot that is readily available to you, depending on the availability wherever you live.
Okay, thank you. Dr. Jawanda, this is for you. I've had anaphylactic reaction to another drug. Is it safe to go get this shot, the vaccination in a pharmacy, or should I go to a mass vaccination site?
Anyone who is providing the vaccine also has the capability of taking care of anaphylactic or any sort of allergic reactions. I did participate in a vaccination clinic where someone did have an anaphylactic reaction to an antibiotic. And what we do for people with that is obviously we're prepared with epinephrine and anything else we need. But what we do, instead of waiting the 15 minutes to observe all patients who are receiving the COVID vaccine, we observe those patients for 30 minutes. So yes, even if you have had an anaphylactic reaction to a different drug like antibiotics, you're completely safe to get the COVID vaccine in a pharmacy or at a mass vaccination clinic.
Okay. Dr. Wallach, can I take Tylenol or Advil before my shot so I don't have side effects?
Excellent question, and the one I'm asked all the time. With any vaccine, actually, we recommend against any prophylactic taking of Tylenol or Advil in the just in case scenario, because it sounds cruel, but we do want you to get these symptoms, the fever, the aches, the headaches. That's like a signal to us that your immune system is actually working. And if we try to pre-take medications, the worry is in other vaccines, they've had studies where it actually dampens that response and you don't produce as good a response. That being said, we do not want you to suffer needlessly. If you get the vaccine and you get symptoms, and there are symptoms that you can't tolerate, by all means, take your Tylenol, take your Advil, take care of yourself, but don't presuppose that something is going to happen. When I got my vaccine, I had a headache, I had muscle aches, I kind of felt icky for like a day. My husband got his, he was fine. So it's hard to predict as well who would get which symptoms.
Okay, I think I'm definitely going to take your advice after our town hall and take a Tylenol. Dr. Bogac, what are the chances with all the such high cases in Canada right now? Are we going to see a Canadian variant?
Oh man, I hope not. We know viruses mutate. We know they change with time. We know that if you let this virus run unchecked, it's going to change, and it's going to change in some nasty ways, as we've seen it done before. Listen, it's always a possibility. It certainly is a possibility, but we don't need to be talking about the variant of concern from Canada like that. We can put that to rest. Let's be hopeful that our provincial governments do the right thing, quell community transmission, vaccinate quickly, and we don't have to be talking about a variant from Canada. We can do better for the world than export variants.
Yes. Okay, Doctor Who, this is for you. When people are vaccinated, can they hang out together?
Well, hopefully soon. Right now, I think you always got to follow your local public health guidances. And in much of Canada, it's still, stay home, stay safe. But, if we look at what's happened in the United States, just this week, come out with some recommendations around vaccinated people hanging out with other vaccinated people flying, all sorts of things that we sort of used to do. Anyways, and so, I think the Canadian government, public health authorities will follow soon. But for now, I think we just want to get out of this third wave as quickly as possible. But, it's coming, like those vaccine passports.
Okay, thanks. Okay, this question is for each of you. So I'd like each of you to answer this. And this is from a very special person. This is Hayley Wickenheiser, 4-time Olympic gold medal hockey player number 22 for Team Canada. She's also close to earning her medical degree. So soon will be Dr. Wickenheiser. This is from Hayley. Thank you, doctors. You are all terrific mentors and heroes of Canada. My question is this. What are you going to do when this ends?
I think we're going in the same order as before, and I was supposed to go first. I am going to spend more time with my family and probably go on several long vacations without a cell phone or computer in sight.
Yeah, I think I'll go just sleep a lot, basically 3-month sleep, hibernation cycle.
I am really looking forward to seeing my parents who live in Edmonton, Alberta. I haven't seen them since February 2020. They're fully vaccinated. I'm fully vaccinated, but I will listen to my provincial health rules and stay put until I'm allowed to travel. And after that, I'm going to Hawaii. No cell phones, no computers.
Yeah, I'm going to take the family and the kids to see their grandparents down in southern Saskatchewan. We haven't seen them since all of this started, and I'm vaccinated, my wife's vaccinated, but the kids aren't. And although the grandparents are, we're following public health advice. And we're going to get together with their cousins, and we're going to find the most cramped and packed place possible with lots and lots of people. And we're going to have a lot of fun.
Yeah, I'm going to organize the largest barbecue I've ever done with all my friends. And I'm going to travel, which is under normal time, something that I really enjoy and I haven't done for a long time.
Wow, that's a great question, and I can't wait. So I'm going to invite people over, and we can all celebrate our successes, and we can all look back and say, we got this under our belt. This is our shot. We need to work together so that we can all celebrate together.
So I am probably going to go around and hug everybody I haven't been allowed to hug. I'm going to hug my kids' teachers because they have been amazing this past year. Hug friends, hug family, and my oldest son has already drawn up a list of, I think it's up to 70 places that he would like us to go to after COVID has ended.
Oh, that's so excellent, Dr. Wallach. Thank you all for sharing that. You are all heroes to us mere mortals. Healthcare workers, frontline healthcare workers of all capacities, we salute you. Our gratitude goes out to each and every one of you for the daily difference that every one of you make. And there you have it. Thank you, everybody, for your questions, for your engagement, for your caring, for your action. This is our shot, Canada. It's clear that the best vaccine is the first vaccine available when it's your turn, and the best vaccine is the one that's in your arm. It's crucial that we all get vaccinated when we can, and this is a monumental effort that is going to go on for some time, but we can see the end, and we all have a role to play in this. This is something that we can do for ourselves, for our communities, our families, our country, and for the world. This is our shot. Find out how you can get involved at thisisOurShot.ca. Today, this campaign began. It's not a campaign that is a day. We will keep this going if it takes weeks, months, however long it takes. We are in this together. And if you like this shirt, it is also a fundraiser. And on the sleeve, you'll see Get Your Shot. It's available in 27 different languages. It's a fundraiser for Kids Help Phone to support youth mental health. Everybody's mental health has been affected, and we have all struggled in some way during this pandemic. Just know that you're not alone, and if you need help, please reach out. There are many numbers that you can call, and if you see someone struggling, make sure you hold the space for them. It can make the difference in somebody's life. We have over 150 ambassadors from music, sport, the arts, from medicine, educators. All people from all communities in Canada have shown their support, have shared their vaccine stories. But this is for everyone. This is for all of us. So please use our hashtag. Get a shirt. You don't have a shirt, get a Sharpie and a piece of paper. Share what this means to you and means to all of us, and encourage the people around you. So again, thank you, doctors. Thank you, everyone. Good night.